Hello, everybody. This is Sharonda, and this is my podcast, Health Matters. Today is January the 27th, which is a Thursday. And as I promised, I would be speaking on more mental health related ailments and illnesses and disorders in my Health Matter podcast, okay? And so it's going to be subtitled Mental Health Matters. So I am on a website, and I'm going to read the information as it mentions in reference to depression or major depressive disorder. So what is depression? Well, it's a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects you, and it affects how you feel, think, and behave, and can lead to a variety of emotional, or physical problems. You may have trouble doing normal day-to-day activities. Sometimes you may feel as if life isn't worth living. More than just a bout of the blues, depression is a weakness, and you can't simply just snap out of it. So depression may require long-term treatment, such as medications or psychotherapy. So what are some of the symptoms of depression? Well, again, feelings of sadness, tearfulness, emptiness, and hopelessness. Angry outbursts, irritability or frustration, even over small matters. Loss of interest or pleasure in most or all normal activities, such as sex, hobbies, or sports. Sleep disturbances, including insomnia or sleeping too much. Tiredness and lack of energy, so even small tests take extra effort. You may have a reduced appetite or weight loss, or you may have increased cravings for foods and weight gain. Also, you have anxiety, may exhibit anxiety, agitation, and restlessness. Depression also may slow your thinking, speaking, or body movements. Feeling of worthlessness or guilt, fixating on past failures or self-blame. Trouble thinking, concentrating, making decisions, and remembering things. Frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide. Unexplained physical problems such as back pain or headaches. So it mentions for many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities such as work, school, social activities, or relationship with others. Some people may feel generally miserable or unhappy without really knowing why. So it also goes into depression symptoms in children. Some of the common signs in younger children are sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, or being underweight. In teens, you may see symptoms of sadness, irritability, feeling negative and worthless, anger, poor performance, or poor attendance at school, feeling misunderstood and extremely sensitive, use of recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interactions. So in the older population, in regards to the depressive symptoms, there may be some memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems, or loss of interest in sex, not caused by a medical condition or medication. Often wanting to stay at home rather than going out to socialize or doing new things. Suicidal thinking or feelings, especially in older men, is when it has mentioned here. So when do you want to see your doctor? Well, if you feel depressed, you want to make an appointment to see your doctor or mental health professional as soon as you can. If you are reluctant to seek treatment, talk to a friend or loved one any healthcare professional, faith leader, or someone else you can trust. When to get emergency help. So if it seems like these symptoms are really, really detrimental to yourself, to where you may cause harm to yourself or even others, call 911 or your local emergency number immediately, okay? There are other numbers that you can call here. It has the suicide hotline number, which is the National Suicide Prevention Lifeline, 1-800-273-TALK. Again, 1-800-273-8255. So, we're going to go over some of the causes. So it has biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neural circuits involved in maintaining mood stability may play a significant role in depression and its treatments. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during weeks or months after delivery, postpartum, and from thyroid problems, menopause, or a number of other conditions. Inherited traits. Depression is more common in people whose blood relatives have these conditions. So what are the risk factors? Well, it mentions that, depression often begins in the late teens, 20s, or 30s. It says more women than men are diagnosed with depression. So risk factors include certain personality traits such as low self-esteem and being too dependent, self-critical, or pessimistic. Traumatic or stressful events such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship, or financial problems. Blood relatives with a history of depression, bipolar disorder, alcoholism, or suicide. Being lesbian, gay, bisexual, or transgender, or having variations in the development of genital organs that aren't clearly male or female, intersex, is an unsupportive situation. In a unsupportive situation, history of other mental health disorders such as anxiety disorder, eating disorders, or post-traumatic stress disorders, abuse of alcohol or recreational drugs, serious or chronic illness including cancer, stroke, chronic pain, or heart disease, certain medications such as some high blood pressure medications or sleeping pills. So, complications. It says depression is a serious disorder that can take a terrible toll on you and your loved ones. Depression often gets worse if it isn't treated. So, examples of complications associated with depression: excess weight or obesity, which can lead to heart disease and diabetes, pain or physical illness, alcohol or drug misuse, anxiety, panic disorders, or social phobia, family conflicts, relationship difficulties, and work or school problems, social isolation, suicidal feelings, suicide attempts, or suicide, self-mutilation such as cutting, premature death from medical conditions. Prevention. So there's no way to prevent depression. However, there are strategies that may be helpful. Take steps to control stress, to increase your resilience, and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather the rough spells. Get treatment at the earliest sign of a problem to help prevent depression from worsening. Consider getting long-term maintenance treatment to help prevent a relapse of symptoms. So, diagnoses and treatments. You may go to the doctor to get a physical exam. In some cases, depression may be linked to underlying physical health problems. Lab tests, a blood test called a complete blood count, or test your thyroid to make sure it's functioning properly. Psychiatric evaluation. Your mental health professional may ask about your symptoms, thoughts, feelings, and behavioral patterns. And, they would do this in reference to a questionnaire. DSM-5, your mental health professional may use this criteria, which is listed in the Diagnostic and Statistic Manual of Mental Disorders, to diagnose you as well. So you have different types of depression, which is anxious distress, depression with unusual restlessness or worry about possible events or loss of control. Mixed features, which is simultaneously depression and mania, which includes elevated self-esteem, talking too much or increased energy. Melancholic features, which is severe depression with lack of response to something that used to bring pleasure and associated with early morning awakening. Worsened mood in the morning, major changes in appetite, and feelings of guilt, agitation, or sluggishness. Atypical features, depression that includes the ability to temporarily be cheered by happy events, increased appetite, excessive need for sleep, sensitivity to rejection, and a heavy feeling in the arms or legs. Psychotic features, depression accompanied by delusions or hallucinations, which may involve personal inadequacy or other negative themes. Catatonia, depression that includes motor activity that involves either uncontrollable and purposeless movement or fixed and inflexible posture. Peripartum onset, this depression occurs during pregnancy or in the weeks or months after delivery, postpartum. Seasonal pattern. You have depression related to changes in seasons and reduced exposure to sunlight. So it goes into other disorders in regards to depressive symptoms. Again, you may be prescribed some medications. The different types of medications may be what they refer to as SSRIs, selective serotonin reuptake inhibitors. These involve Celexa, Lexapro, Prozac, Paxil, Hexaval, Zoloft, and Vilbrit. Serotonin non-epinephrine reuptake inhibitors, SNRIs. This includes Cymbalta, Effexor, Prestique, Cadiza, and Fexima. Atypical antidepressants. This includes Wellbutrin, Aplenzin, Forfivo, Remeron, and Trintellix. Tricyclic antidepressants. This includes Tofranil, Pamilar, Somontil, Norhermin, Valvectil, to name a few. Also MAOs, monoxamine oxidase inhibitors, which includes Pamate, Nardil, Marplan, as well as MSAM. So there are other medications that you may be prescribed in addition to the depression medications, such as mood stabilizers or antipsychotics. Okay, so when you do go and visit your primary care physician and they may refer you out to a mental health professional, there's going to be a trial and error that you will need to go through in terms of your medications to make sure that it is the right fit for you, okay? And also, there is a disclaimer here in reference to, your medications, again, with finding the right combination that will be beneficial to your system. There is a risk with stopping these medications, so you just don't want to abruptly stop these medications because, me being the LPN and working in mental health, you may exhibit some withdrawal-like symptoms if you abruptly stop these medications. So you will need to be weaned off of these medications. As well as if you take these medications and you are pregnant, there may be some risks for the baby in regards to taking these medications while you are pregnant. So take caution to that. Also, some of these antidepressant medications can increase the risk of suicide. So you want to take precautions in terms of that, okay? There are some psychotherapy that you can take to help with your depression, which is, such as cognitive behavioral therapy or interpersonal therapy. And they can help you adjust to crisis or other current difficulty, identify negative beliefs and behaviors and replace them with healthy, positive ones, explore relationships and experiences, and develop positive interactions with others, find better ways to cope and solve problems, identify issues that contribute to your depression and change behaviors that make it worse, regain a sense of satisfaction and control in your life, and help ease depression symptoms such as hopelessness and anger. It also can help to you to learn to set realistic goals for your life, develop the ability to tolerate and accept distress using healthier behaviors. You do have some options, some alternative formats for therapy, which may be, visiting a doctor for some one-on-one counseling service or some telehealth one-on-one counseling service as well. You do have hospital and residential treatment facilities where you may need to be hospitalized for a series of days or even weeks. They do have other treatment options, ECT, which is electroconvulsive therapy. This involves electrical currents that are passed through the brain to impact the function and affect the neurotransmitters in your brain to relieve depression. ECT is usually used for people who don't get better with medications, can't take antidepressants for health reasons, or at a high risk of suicide. You also have transcranial magnetic stimulation, TMS, which may be an option for those who haven't responded to antidepressants. During TMS, a treatment coil placed against your scalp sends brief magnetic pulses to stimulate nerve cells in your brain that are involved in mood regulation and depression. So, lifestyle and home remedies. Depression generally isn't a disorder that you can just treat on your own. So, you may need to stick to your treatment plan. Don't skip psychotherapy sessions or appointments. Even if you're feeling well, don't skip your medications. If you stop, depression symptoms may come back, and you could also experience withdrawal-like symptoms. Okay? Learn about depression. Education about your condition can empower you and motivate you to stick to your treatment plan. So encourage your family to learn about depression to help them understand and support you. Pay attention to warning signs. Work with your doctor or therapist to learn what might trigger your depression symptoms. Make a plan so that you know what to do if your symptoms get worse. Contact your doctor or therapist if you notice any changes in symptoms or how you feel. Ask relatives or friends to help watch for warning signs. You want to avoid alcohol and recreational drugs. It may seem like alcohol or drugs lessen depression symptoms, but in the long run, they generally worsen symptoms and make depression harder to treat. So you want to talk with your doctor or therapist if you need help with alcohol or substance use. Take care of yourself. Eat healthy. Be physically active and get plenty of sleep. Consider walking, jogging, swimming, gardening, or another activity that you can enjoy. Sleeping well is important for both your physical and mental well-being. Okay, so these are some things that are, beneficial. Now you have alternative medications that, your doctor may speak with you about, such as supplements. St. John's wort is one of those herbal supplements. It mentions that it's not FDA approved, but to treat depression, but it may be helpful for mild to moderate depression. Now, if you are taking certain medications, you want to be mindful with taking this St. John's wort, because like any other medication, there will be some interactions, okay? SAMe is another drug that you may be able to take. It isn't FDA approved to treat depression in the United States, but there has been some positive reports out there. If you begin to see the commercials and things about SAMe. Omega-3 fatty acids. These healthy fatty fats are found in cold water fish, flaxseed, flax oil, walnuts, and other foods. So it is safe. Ultimately, it's safe, and it can help to relieve some of those depressive symptoms. You may also want to go with some mind-body connections, as it has here. Acupuncture, relaxation techniques such as yoga or Tai Chi, meditation, guided imagery, massage therapy, music or art therapy, spirituality and aerobic exercise, coping and support. So you want to simplify your life, cut back on obligations when possible, and set reasonable goals for yourself. Give yourself permission to do less when you feel down. Write a journal. Journaling as a part of your treatment may improve mood by allowing you to express pain, anger, fear, or other emotions. Read reputable self-help books and websites. Your doctor or therapist may be able to recommend books or websites to read. Locate helpful groups. There are mental organizations such as NAMI, National Alliance on Mental Illness, and the Depression and Bipolar Support Alliance that offer education support groups, counseling, and other resources to help with depression. If you're employed, your doctor your employment may offer employee assistance programs, and religious groups may be helpful with your mental health concerns as well. Don't become isolated. Try to participate in social activities and get together with family and friends regularly. Support groups for people with depression can help you connect to others facing similar challenges and share experiences. Learn ways to relax and manage your stress. Examples include meditation, progressive muscle relaxation, yoga, and Tai Chi. Structure your time, plan your day. You may find it helps to make a list of daily tasks, use sticky notes as reminders, or use a planner to stay organized. Don't make important decisions when you're down. Avoid decision making when you're feeling depressed, since you may not be thinking clearly. So when you prepare for your appointment to the doctor, you want to, ask a series of questions. Is depression the most likely cause of my symptoms? What are other possible causes for my symptoms? What kind of tests will I need? What treatment is likely to work best for me? What are the alternatives to the primary approach that you're suggesting? I have these other health concerns. How can I best manage them together? Are there any restrictions that I need to follow? Should I see a psychiatrist or other mental health professional? What are the main side effects of the medications you're recommending? Is there a generic alternative to the medicine you're prescribing? Are there any brochures or printed material that I can have? What websites do you recommend? So it says what to expect from your doctor. Your doctor will likely ask you a number of questions, and they may ask things such as, when did you or your loved ones first notice your symptoms of depression? How long have you felt depressed? Do you generally always feel down, or does your mood fluctuate? Does your mood ever swing from feeling down to feeling intensely happy or euphoric and full of energy? Do you ever have suicidal thoughts when you're feeling down? Do your symptoms interfere with your daily life or relationships? Do you have any blood relatives with depression or another mood disorder? What other mental or physical health conditions do you have? Do you drink alcohol or use recreational drugs? How much do you sleep at night? Does it change over time? What, if anything, seems to improve your symptoms? What, if anything, appears to worsen your symptoms? Okay, so I am going to conclude this episode of Health Matters, subtitle Mental Health Matters. And until then, you have a safe and wonderful day. Good day.